Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and I am here today with my cheery co-host, Dr. Millicent Rovelo. How are you doing?
I'm good. I was so sure you were going to say snarky because I've been like a little snarky lately. So thank you for thinking that I'm cheery.
But you've been cheery also.
I've been like a cheery snarky.
You've been cheery snarky.
I've been snarky with a smile.
But cheery.
Yes.
So I think that's what this is about. This topic, I go into it with great trepidation because
I'm a little terrified, but sorry, go on. Carry on. Don't mind me.
Revision of the failed preservation rhinoplasty.
That's a lot of big words.
So let me break this down for everyone. Preservation rhinoplasty is a
Here we go.
concept that has rooted in, I think, the rhinoplasty cognoscente around the world. And it's, I think, elusive to a lot of us who do a lot of rhinoplasty, where it's like, I don't see the point. Like, why do I need to do this? I understand why people are doing preservation rhinoplasty. And
well, what is it?
So
for the average layperson,
right,
what is it?
So it's a technique. Rhinoplasty, and
it's a technique. So what's the technique?
It's a technique where you preserve the bridge of the nose.
The top
part, this part, where instead of shaving down the bone and trimming the cartilage, you leave the actual natural architecture of the bridge of the nose, the shape of the nose. And you, in order to get rid of a hump, you would push it into the face or let it drop down into the face by operating on the structures deep to it, but leaving all of this natural architecture intact.
The idea being that you don't disrupt the natural attachments and ligamentous structures of the nose, hence the terminology preservation, and you do more of a deep dissection and manipulation. But the concept is that the outside, the top part of the nose is preserved.
Right. And it totally makes sense. It's like there's nothing wrong with the natural anatomy of the bridge of the nose. So we're going to leave it intact and push it down by trimming underneath. It's like if you imagine the house, the roof of a house is 25 feet high, and you're saying, oh, it's too high, we'd like it to be at 15 feet. Well, instead of taking off the roof and pushing everything down and then rebuilding the roof, you leave the roof and everything intact, but the central struts that hold the house up, you're going to take 10 feet of that out from the middle of the house and drop the whole roof down onto it.
Right. Yeah, that's a good analogy.
That's how it works.
And the reason people do it is because the thought is that if you preserve those natural structures, the attachments, you'll have less problems, you'll have less issues related to basically surgically created deformities.
Right. And I agree with that. And this is a technique that was developed in, I think the first publication was in 1857. It's a time-honored technique. And it wasn't called preservation rhinoplasty then. It was just rhinoplasty. And, then along comes, a group of rhinoplasty surgeons from around the world who get together and say, we don't really need to do all of this structural rhinoplasty stuff that, we've been doing. It's too hard. Let's do this preservation concept, and let's take this old school approach of leaving everything intact and pushing it down, which for the most part, it works. And, it's great. And the people that do it love it, and they swear by it. And in fact, they're religious about it. They attack me for not doing it, which is interesting. They sideline people that, don't do it and say, well, they must not really understand why this is so awesome. But I am a revision rhinoplasty surgeon. I'm known around the world as a revision rhinoplasty surgeon. And so when things don't go well, that stuff that hasn't gone well tends to wind up in my office, which is not a problem, and it's not a big deal. But it's created a new category of revision rhinoplasty for me. And so in understanding that, for those of you who've had a preservation rhinoplasty and need a revision, well, this is the podcast for you, because there are nuances, problems, and new approaches that are necessary in revising the failed preservation rhinoplasty. Now, considering what I do and that this concept has been out there now for some time, I can only cite about 40 of these operations, of these revisions that I've done in the last 4 or 5 years, probably 4 years. It was about 2019, I think I started seeing the need to be able to revise preservation rhinoplasties. And they were different because the septum has been treated very differently than in a traditional closed or open structural rhinoplasty. And for those of you wondering what that means, it means whether you've done the operation from inside the nose, the quote-unquote scarless rhinoplasty, hate that term, or the open where you cut the columella and flip the skin up and then work on the structures, bring the skin down and close. So this is different because it is because the septum gets a different treatment when you do quote-unquote a high septal strip or a low strip of the septum to push the roof of the house down. Then how you reconstruct that when it doesn't go well is very different.
Right. So that being said, like you said, you are a revision rhinoplasty surgeon. So you certainly see revisions from all types of surgeons, all styles of rhinoplasty. We're not saying that you're only doing preservation revisions. You're seeing revisions from like all kinds and styles and techniques.
Of course.
But the point is, when you have to do a revision on a preservation rhinoplasty, it's much different because the technique is different. And so you're dealing with a whole sort of different subset of problems than you previously were before.
Correct. And if you have that information that you know that you've had a preservation rhinoplasty, to quote Adam Sandler from The Wedding Singer, that's information I could have used yesterday. So
it is
please
helpful
tell me.
to your surgeon to let them know, because it is very helpful. Because at least you'll know before going in there what to expect. And
Totally.
then you won't suffer the whole OR with your quotes from The Wedding Singer.
And so I did just come from fresh off a preservation rhinoplasty revision.
And what did you find? What did you find when you went in there?
So this is really interesting.
Actually, let me rephrase that question. Why did the patient come to you? What was their complaint for why they wanted or needed a revision?
Probably the biggest issue is they couldn't breathe. So that's the other concept of preservation is by dropping the roof of the house down, you should not disturb the internal valves.
Internal valves or it's just like the canals that you can breathe through, the nostrils, the more deeper internal part of the nostrils.
Right. So by doing that, you should, there's a lot of, I am not here to knock preservation rhinoplasty. I think for those of you who do it and those of you who like it, those of you who want that, that's great. It hasn't offered me a whole lot of benefit. And in reality, obviously, me seeing all these preservation rhinoplasties that need to be revised makes me go, this would have been better structurally. Of course it would have been because, there were other options, and et cetera. So I'm not here to knock it. I have great friends that do a ton of preservation rhinoplasty. They're so good at it. They get the results that they want. I personally find that there are some things about preservation that aren't enough for me to sink my teeth into it. But, one of our colleagues who's in the fellowship faculty loves preservation rhinoplasty. He's modified it his way, and he's getting the results that he wants, and he's thrilled with it. So I'm not going to sit here and knock it. But I will say that when coming to revision for it, there are some specialty pieces that are important. First of all, what happened today was that the whole middle vault that had been pushed down fell over to the side. And maybe they were trying to correct a deviation or something like that. And so they tried to take the bridge and move it to the left, but it fell in, and the breathing was awful. It was terrible. And so as I get into it, and I did not know this was going to be what I found. This was one, again,
Adam Sandler.
Information I could have used yesterday. I take the whole thing apart. I lift up the bridge, and I see that it's been a high septal strip. And I said, okay, well, to fix this now, we've got some issues.
So you can tell when you're looking at it that it was a preservation.
100%. Yeah, of course. I mean, nobody treats the septum that way unless you're doing a preservation. And the entire bridge was intact except that it was
tilted
over to the left side of the nasal airway, and it was obstructing the nasal airway. So I take the whole thing apart, move it up. And so here are the concepts for the surgeons listening, and then also for the patients listening. Find somebody who knows how to revise these, number one. Number two, you have to recognize that the structure that you would normally count on to do a revision rhinoplasty is gone. Normally, that septal, that high portion of the septum that you're going to, you're going to use some spreader grafts, or you might, have to, put some kind of onlay grafts, things like gone. And you have that roof of the house with the central strut. That's one unit. And typically, what I wind up doing is either taking that apart, preserving the parts of it that I can use, like the lateral, whatever aspects of the middle vault are still usable, but more than likely, I got to rebuild the whole thing.
Rebuild the whole thing.
100%.
And so in your hands, that usually means rib. And
yes.
So again, information you could have used yesterday, because you want to know if you have to take rib, although you usually do. But for surgeons
100%.
that maybe don't take rib routinely,
have one in the fridge.
Take one off the shelf, or just routinely consent your patients for rib, because if you don't know that, then you're kind of stuck, because there's not a whole lot of else that's sturdy and structural that you can use to literally rebuild this nose.
We use a term for that if you get there and you didn't know what was coming, called getting pantsed, where somebody pulls your pants down around your ankles and you're standing there with nothing you can do about it. So you don't want to get pantsed.
You don't get pantsed.
No. And so I do typically, if I'm doing a revision rhinoplasty of any kind, I'm typically saying I might need composite ear cartilage grafts. I might need deep temporalis fascia grafts. I might need rib cartilage grafts. I might need some kind of graft that I haven't even thought of, something so cool that it's not even, maybe a dermis fat graft. But I go through that and just say, look, I need to use what I need to use to fix this, because I don't really know what I'm going to find in there. And reading the operative notes, I guess, is okay, but I will tell you, on many preservation rhinoplasties that I've read the op notes on, it'll be a stock note that says like, oh, I placed spreader grafts, I did this, I did septoplasty, and I get in there and there are no spreader grafts. There's no septoplasty, there's no nothing. It's a preservation.
If you can even get an operative report, which is unusual.
So you have to be ready for everything. And people always say, is the operative note helpful to you? And I go, I'd like to read it, but it's not usually helpful, because it's usually something that they just have
template
it's printed out, or they took a second, or whatever. Like, my operative notes are not very helpful to anybody. I say, I opened the nose, I fixed the bridge, I did some spreader graft. Like, I do dictate what I did, but it's not done like a patent. What they say at the patent office, if you file a patent, those who are skilled in the art should be able to recreate what it is that you did. An operative note basically says kind of what you did, so that people who are in the know of what you do can know what you did. Yeah. But they don't know, like, all the details. And then I used a 15 blade with a bevel that, it's not that specific. Yeah. So I think with these preservation noses that, when you're revising them, if you're a patient who knows that you've had a preservation rhinoplasty and you're not happy, you should bring that to the attention to the revision surgeon, that's what you believe happened, and then tell them why you're not happy. And ultimately for me, what has been the real savior of this is having rib cartilage, because I've been able to rebuild the L strut, rebuild the septum, however it is. And a lot of times there's a lot of septum left, and you can use the septum to rebuild it too, but it's not quite strong enough in a revision situation. As I've told you in the past, we've talked about this, where the scar tissue of a previous rhinoplasty can win the battle over ear cartilage and septal cartilage pretty easily. Yeah,
they're just not strong enough.
Exactly.
It needs some heft.
The rib's got some beef to it, so it can do the job. Even off the shelf, products, MTF. I am a consultant to MTF, but that's my kind of go-to, and I'm a consultant to them because I use it so much, I guess. But those kind of products are really great. Radiated rib people do use. There's other rib cartilage products. There's but ear and septum to me are like not awesome for revision. I really like autogenous rib best. So an autogenous means from the own patient, because I saw your glossary of terms going through, and I'll define that. But you can revise these. They can turn out great, but you have to be fairly, I guess it's really complete in the approach to it. You can't, there's not a way to kind of do something small.
You can't preserve the preservation rhinoplasty is what you're saying. You got to go big on these.
Yeah, you have to kind of take it apart and put it back together. Yeah. But they can be fixed, and you can get great results.
Do you notice anything different in their healing, or do they have more of the typical post-op revision rhinoplasty course that all of your other patients would have?
No, pretty standard.
Pretty standard. Okay. So it's just more about for your intents and purposes and the revision surgeons going forward. If you know that you had a preservation rhinoplasty, that is helpful, and plan on doing a big deal revision.
Right. And I am going to write this up for, some journal. Unfortunately, a lot of the editors of the journals are preservationists, so they probably aren't going to like this article very much.
The drama and the intrigue increases.
See, people don't know this stuff. Like if you're like at the lay public sitting at home, you're like, that's interesting that the publisher, the editor of the journal, might not like the article coming in because it's not what they do, or it undermines what they do, or it says what they do isn't correct or whatever. So they're going to reject it. And that is, reality of
There's
the world
politics
we live in.
everywhere.
Politics in
Everywhere.
corner. Absolutely. But I am happy that the ones that I have revised have done very well. And I've had a very low revision rate on my revisions of preservation rhinoplasties.
Nice.
Very low. And that is interesting. It's lower than my actual average. Now, it's probably because I haven't done enough. Like I said,
True.
I'm coming up on 40. I think I have 38 right now. So I'm coming up on about 40 of these revisions. But it's very low. And I don't know why that is.
I don't know. Something we'll have to look into in the paper.
Yeah, I mean, I think in the discussion I would say that because there's no rhyme or reason to that. So it's like for me to make some sort of, hypothesis of why would probably be sort of, it's just not enough patients to really understand.
Your end's too low.
It's too low. But I don't think I've revised any of them. And I think, they've done really well. Their airways have been good. And I would basically, if you had to say, why do you think that is? It's because their preservation rhinoplasty didn't demolish a lot of the nose.
I mean, that would make sense, that they preserved a lot of the natural ligamentous structures of the nose and the structure of the nose, so it's less destroyed.
Right, and the septum is still pretty well intact.
Yeah.
It's just been, there's been a strip or whatever. And so I think putting it back together is like less onerous than if you had not preserved it. Like some of the revisions I do, like it just looks like somebody like lifted up the skin, threw a grenade in there, and put it back down.
Good luck.
And
Hope you like your nose.
Yeah, and it's just been awful. But, these are a little different. And so that's why I wanted to talk about today, because I'm fresh off a revision of a preservation rhinoplasty that turned out very nice. I think it's going to be great.
Great.
But I think people should know that that's an issue, and that if you know you've had a preservation rhinoplasty and you're sitting there going like, this isn't what I had in mind, you need to find somebody who's skilled in the art of revisions of preservation rhinoplasty.
And tell them, so they don't have to quote Adam Sandler in the OR, to the benefit of all of us.
I think we have to put that quote into this podcast somewhere. I mean, Sean, our producer, do you think that's possible? Can we do that? He's nodding. Yes, I think that's doable. I think it would be great because it's so funny.
Once again, things that could have been brought to my attention yesterday.
Do you have any questions about that, Dr. Rovelo?
No, I think you did a very excellent and restrained job.
Restrained.
You were.
See?
You were so good.
No soapbox.
No soapbox today.
No.
So good job. I think you did a great job explaining it. And yes, all good.
Then this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.